The patient decided, as mentioned, to continue on the lenalidomide and dexamethasone without the proteasome inhibitor, and she was followed and felt well. But a few years later, her markers for her disease started to increase. So her monoclonal protein went from 0.5 grams per deciliter to 0.7 to then 0.9. She felt well. She really didn't have any complaints, but it was clear that her disease was growing, and so a decision had to be made regarding treatment. I think historically patients were not always treated when their disease was growing by the test if they felt well, but I think historically we didn't have drugs that would be well tolerated. And chemotherapy drugs have kind of a limited lifespan. They can cause harm when you give them for a long period of time. But I personally believe, and I think most data back this up, that if patients' disease is growing, even if they feel well, they should be started on treatment to get their cancer back under control. When you're deciding whether to start somebody on treatment, particularly when they're feeling well, I think it is important to be certain that the cancer is growing. So a lot of the ways we follow this disease is based on lab tests. There are errors in the testing, that's done. Certainly mistakes can happen in the lab. So in studies and certainly in practice, one should be certain that the markers are getting worse. Usually in studies, you have to have confirmatory testing to prove the cancer is growing back. But once the monoclonal protein spike has doubled, or whatever light chain that their myeloma is making is significantly increasing, then I think that's enough information to embark on treatment.